Good morning and welcome, everyone. My name is Kimberly Russo, and I'm honored to serve as the CEO here at the George Washington University Hospital. I'm so pleased to have you here today as we celebrate innovative technology that is changing care for patients and their physicians. As an academic medical center, GW Hospital is constantly looking at ways to advance medicine. A major component of our mission is bringing the latest technology to our patients. We recognize the valuable role that technology can play in enhancing patient care and their outcomes. That is why we are committed to investing in state-of-the-art technologies that will bring a higher level of care to individuals in the DC region and beyond. The exciting technology that you will learn about today is not only allowing our physicians to provide more precise care, but it is helping our patients in having a better experience through their medical journey.
Well, hello to all. My name is Bob Axelrani. I'm the chief for the Center for Trauma and Critical Care here at George Washington. I'm going to be discussing with you guys a novel technology that we too were the first to use in the world, certainly in the United States and DC, therefore, that relies on augmented reality. So it builds nicely on Dr. Mortman's introduction to his needs. In my world, in general surgery and acute care trauma surgery, it's well known that the size of the incision that we make to operate on somebody is directly correlated to the amount of pain that they'll have after the operation. As well, the amount of time we take to get to the target where we need to be surgically correlates to worse outcomes. The longer you're in the operating room, the worse your outcomes. And we got lucky in that we were able to find this system, augmented reality, which we're going to demonstrate in a second, that allows the surgeon to overlay the CAT scan onto the patient. When I put on the headset, not only do I see the patient laying on the OR table, I see the CT scan depicted on top of them as a hologram. So I can see both in the real time. And if we were to move the patient on the operating room table to reposition the individual, the image moves with them. And now it becomes very, very easy to say, well, there's the problem right there. Rather than making a 6-inch incision, let's make a 3-inch incision. Rather than spending 15, 20 minutes digging around, let's spend about 2 minutes dropping right down on top of it. And then let us fix this immediately and get off the table, meeting all of our goals of precision, appropriate size incision, wrap it in, wrap it out, off the table. So with that, I'd actually like to introduce Dr. Wendell Gibby, who is the inventor of this technology and the president of the company, and a radiologist in his due turn.
Using augmented reality. What is augmented reality? Well, it is, you saw virtual reality, and that's where a computer screen sort of is immersive and it shows you these 3D images. With augmented reality, we actually have glasses that we can see the patient, but we have these little reflector lenses in there that projects a hologram on top of them at the same time. So doing that, we can see the patient and we can see through the patient at the same time. What does that give you? That gives you the ability to, instead of looking up at a screen, trying to translate to where you're at, you can look right at the patient, know where the problem is, make your incision, start your needle track, do whatever it's going to be in real time with tremendous precision. So this isn't working. Yeah,
It is
I guess it
working.
is. Okay. So I'm going to do a little demo here. This is Amanda, my administrative assistant, who graciously came out from Utah. And we scanned her heart last week. These aren't as pretty as CT scans because she's young and we didn't want to radiate her. So we used MRI. And I will show you a few pictures here if it's set up. Okay. Turn sculpting on. And this is her actual beating heart. Are we okay? Yeah, inside of her chest. A doctor, in the case of Dr. Serrani, could see ribs, could see vessels. He could say, this is exactly where I want to make my incision. And this is projected in real time. It knows where I'm at. It knows where this hologram is. It knows where she's at. So as I move, it will automatically reconstruct. I could even come underneath the patient and you would see the back side. And it's reconstructing on the fly here. So we can say slice mode on, and I could go into various slices, go through the heart and see different vessels. I could have virtual tools that would guide me into the patient. So this is an example of augmented reality where you can see the patient here. Her images, these high-tech CT and MRI images which we have come accustomed to in the last few decades, are now not only on a screen over on some doctor's desk or down in radiology, but they are integrated into the actual care of the patient. I believe we're at the cusp of a revolution here with the ability to integrate these advanced medical imaging techniques which doctors so deeply rely on today and put that right into an immersive operative experience. I mean, you think about here, you have a training environment, you have young surgeons who may not have seen some of these procedures before. They can preoperatively go in and practice. They can look at the patient, walk around, see their approach, there's the mass, there's the heart, and it's not limited to ribs. It can be done, there are a whole bunch of things that we do in medicine where we need better precision, we need shorter OR times, we need less blood loss and so forth. So it's a really exciting revolution, and GW is leading the way here.
So I look forward to entertaining any questions along with my colleagues.
Let me just...
Yep.
The images on the holographic thing are much better than what project on the screen. So if you have a second afterwards, I've got a couple HoloLenses here. You can take the OpenSight device and just look for yourself real quick and get a sense of the cool factor.
Thank you.